The time from exposure to developing the rash is 10 to 14 days, with a range of 7 to 21 days from exposure to rash onset. Ideally, reverse transcriptase polymerase chain reaction, or RT-PCR, on a nasopharyngeal or oropharyngeal swab or urine should be performed alongside serology, or IgM, for all suspect measles cases. It's important to note that using IgM alone to test patients with low pretest probability of having measles will lead to more false positive than true positive results. RT-PCR is available in most state laboratories, at the VPD reference centers, and the CDC. Some commercial laboratories offer standalone measles RT-PCR or inclusion of measles in panel-based testing. However, CDC recommends that providers coordinate measles testing through their state or local public health agency. All RT-PCR positive specimens should be directed to a VPD reference center or CDC for genotyping. A link to the VPD reference centers is at the bottom of the slide. CDC epidemiology and laboratory teams are available for consultation to help with measles diagnosis, if needed. A key part of measles investigations is to identify cases, establish the diagnosis, and gather some key pieces of information. This includes gathering the clinical and laboratory data to understand if the case is confirmed and by what method, gather a detailed vaccination history, including all doses of measles-containing vaccines and dates of administration. In the U.S., measles vaccination is included only as part of MMR or MMRV vaccine, which includes varicella, but globally, MR, that is measles rubella, and measles-only vaccines are used as well. Finally, gathering information about measles exposures in the 21 days before rash onset is important, including international travel or exposure to known measles cases. If a confirmed measles case has no travel or known exposure in the 21 days before rash onset, it's important to consider places where they might have been exposed to an unknown measles case. This includes school, childcare facilities, places where they may have been exposed to international travelers, including domestic or international airports, tourist locations, or finally, healthcare facilities. As we discussed, the average time from exposure to rash onset is 10 to 14 days. So for example, a visit to a busy emergency room 14 days before rash onset would be concerning for possible exposure at that healthcare setting and may warrant further investigation. Contact management involves identifying all locations where measles exposures may have occurred during the infectious period of the confirmed case, that is, 4 days before to 4 days after rash onset. Investigators should identify and prioritize susceptible contacts, especially those with close contact, including households or daycare and school classrooms, for monitoring or other interventions, including post-exposure prophylaxis or PEP. Exposed persons at higher risk of severe disease who may require PEP include infants less than 1 year of age, pregnant women, and people with immunocompromising conditions. Finally, quarantine or exclusion from high-risk settings may be warranted for exposed contacts without evidence of immunity.
Dr. Oliver, what tests are most important to perform to diagnose mumps?
Thank you for the question, Dr. Sugarman. PCR is the preferred test type to confirm mumps infection